an examination that you should be able to do in most countries, and also completion of an acceptable primary medical qualification. So that means that that you've got a medical degree from an approved university that the UK recognises. Now, PLAB 1. Now, PLAB 1 is what we're going to talk about today. This is an MCQ-based exam, and it's the best answer examination. PLAB 2 is the clinical OSCE-based exam. So PLAB 1, there's the option to do this 4 times a year at different parts of the world. The up-to-date centres are based on the GMC website. So it's important that because it's only 4 times a year, that you get it right first time, and that you're able to pass first time through the right preparation. Now, PLAB 2 is a clinical OSCE-based exam that has to be done face-to-face within Manchester in the GMC. When I say GMC, that's the General Medical Council. They regulate doctors, and they'll be the organisation that will give you your licence, and it's based at their examination centre within Manchester. So next slide, please. So this is just a diagram for a pathway to UK registration. So medical school qualification, you've got 1 year experience. You pass your, so next point is that you pass your English examinations, so just to show that you're able to communicate in English. So you need a minimum of 7 on the IELTS. That's in each area, and 7.5 overall. And if it's the OET, you need a minimum of B in each area. Now, for PLAB 1, obviously that's undertaken in your home country or an approved overseas location. This is an online exam. And PLAB 2, that's undertaken in Manchester, UK. It's a clinical face-to-face examination. So next slide, please. So we're just going to go through a few general points about PLAB 1. So this is an exam that tests the application of medical knowledge in a clinical setting. So it's not necessarily a theoretical exam. It's how can you apply knowledge as a doctor? So to a patient setting, a clinical setting. So this may not be, testing you about specifics of, immunology and T cells. It's about how you can manage a clinical situation. Now, we also don't cram medical knowledge and textbook medicine. You have to focus your learning with respect to PLAB 1. It is a straightforward exam. Most of you watching this are going to be doctors, and the fact that you've passed medical school, that you've managed to get through your internship year, will mean that actually, you should be absolutely fine to take this exam as long as you prepare for it. So practice is key. So say normally give yourself, in the context of you working as a full-time doctor, give yourself around 2 months to prepare for PLAB 1. And your main focus should be on clinical scenarios and question banks. And it's not about obscure facts, it's about on what you need to know. So next slide, please. So the clinical scenarios aren't random. They're commonly encountered problems that an FY2 doctor will face. An FY2 doctor is a foundation year 2 doctor. So post-medical school, you have your internship year, which in the UK is called the foundation year 1 year, which is a house officer year or internship year, depending on where you are in the world. But this is what you should be able to manage. PLAB 1 is set at the level that you should be able, conditions that you should be able to manage as a day 1 FY2 doctor. Now, FY2 doctors in the UK are expected to initiate management of acute conditions. You need to know how to manage emergencies, identify life-threatening signs. And one of the things that we always say is have a look at the level at which you need to know is on the GMC PLAB blueprint. And we've got the link here, just at the bottom of the screen. And if you click on the link, you can read the level at which you need to know or what you need to know. And the UK guidelines for each condition. And again, in our question bank, which you can access through our website or via GGH, you'll have an explanation for each question within the question bank as to why that's correct and why another question may not be the right answer. So next slide, please. So PLAB 1 tips, so same with any MCQ, multiple choice question format exam. So the amount of content can always look overwhelming. So what we normally say is use the question bank that we have and start answering questions by topic. So split by dermatology, neurology, surgery, for example. And the more you repeat these repetition of concepts, questions and information, it'll help you cement your knowledge. So if, say, you get a question wrong on our question bank, and in the answer, it'll tell you why you went wrong. And if you keep going through those things again and again, it'll cement your knowledge. You'll know for the next time that, should you come through a similar question on the real exam, you'll know, well, actually, this is why this is the correct answer. So that's why we always say, read the explanations for each question and understand why the other 4 options are wrong. Because remember, this is a best answer exam. So it may be that you might have more than one answer that might be right, but one is going to be more right than the other. So next slide, please. So again, there's an option to use a flag within the question bank. So you use a flag option to highlight topics you're getting wrong repeatedly. So some people are stronger at surgery than say dermatology, or some people are stronger at neurology than they are at neurology. So use the flag option to highlight those topics, and that's where you need to you need more work with regards to cementing your knowledge and reading a bit more about the subjects that perhaps you don't pay attention to that well when you're at medical school. But now at WH Medical, we can always offer support for specific areas of weakness. So we're always we are available for specific queries. Now, what we say, aim to do the complete question bank twice and take timed mock exams, because when you're in the exam, you need to time yourself. What you don't want is to get through the exam and you've only got, you're only halfway through and you've only got 10 minutes left. So you need to know what the speed of the test feels like and how quickly you need to work. Now, one of the things we always say, pay attention to the language used in questions. Now, UK English has a lot of colloquialisms. That's local type language. So it's things that might not necessarily be in textbooks, but it's used within the UK. So just pay attention to the language used. Read the question properly before picking an answer. And Dr. Haroon's going to go through the techniques for that in the latter part of the presentation. So we always say, visualize each scenario, put yourself in the situation that the question describes. So imagine, you're the doctor there in that situation. You say it's an emergency question or a question for emergency medicine. Think, what would you do? Doctors are well trained to react in a certain way in emergency scenarios. So, stay calm and put yourself in that situation, and it'll help you with your decision making. So, next slide, please. So, take the pressure off when you're actually doing the exam. The actual score you get doesn't matter. And that might seem like an odd statement to make, but the score doesn't depend, as long as you pass. It doesn't matter whether, when you start applying for jobs, no one will ask you what your score was for your PLAB 1. So the focus here is on passing the exam. What we always say, always aim for excellence, aim for 100% that you don't get a single question wrong. But ultimately, it depends on how you perform on the day. It's whether you pass or not. And if you, if you fail, it has no bearing at all on future job applications. So there is a maximum of 4 attempts on the PLAB 1 exam. So we always aim for you to pass it first time and not to go to the second time. But it's just to let you know that there are 4 attempts. You can attempt a 5th time, but you have to show evidence of additional learning over a 12-month period to the GMC before they allow you to sit the exam a 5th time. So next slide, please. Now, this is an interesting slide because I wanted to just we wanted to highlight what the actual pass rate is for PLAB 1. So the number of candidates, one of the things that's interesting, as you can see from 2015 to 2019, the massive increase in the number of doctors sitting the PLAB. So you go from 2,700 in 2015 to 11,000 in 2019. Now, there's a reason for this, and that's because the UK does definitely need doctors. There's a retirement bubble, so lots of doctors are retiring. The number of doctors, from 2,000 all the way to 11,000 means that there's a lot of demand there, and there's a lot of doctors obviously wanting to come to the UK, and it's a great place to work. The NHS as an organisation is one of the largest employers within the world, and in the UK, it's a system where people can come to the front doors of an emergency department and get life-saving treatment and not worry about necessarily the cost of treatment, whereas because it's a system that where you can get the best healthcare and access to some of the best doctors. So that's why a lot of people want to work within the UK, and it is a great place to work. And the NHS is a great organisation. So because there's the retirement bubble, there's lots of doctors retiring. We always need more doctors. So 11,000 doctors last year applied for the PLAB 1. But if you have a look at on the right side column, the percentage rate, that's the pass rate. That stayed much the same. So from 69% to about 64% last year. So that means, around about a third of people fail the PLAB 1 exam. So that's why it's important you prepare. And if you use our question bank, we can help you prepare through not just PLAB 1, but also PLAB 2. So next slide, please. So PLAB 1, there's 4 main types of questions. So you've got your essential concepts. So these are the basic competence levels that every doctor should know. The very basic level of knowledge. So these are the essential bits that would you be expected to, as a doctor, be able to pass through very relatively easily. And then you've got your distinction level knowledge. That's to separate, the people that really know the detail of medicine and may have more experience, and that you may not be expected to get every question right, but that distinction level knowledge, there's a few of those questions within the exam. But you always aim to get 100%. You always aim to make sure that you get your level, you get your preparation and level up to that point at which you are at that distinction level. So the other questions that test understanding and reasoning behind what the question is asking you. So it's about application. And the 4th type of question is it's a knowledge-based question. It's a facts-based question. You either know these or you don't. So sometimes it can be difficult to get try and deduct which the right question might be. You could have certainly a best guess, but you either know some of these questions or you don't know these facts. So next slide, please. So the actual exam itself, you've got 180 minutes to complete 180 questions. You identify the type of question early, from the 4 types of that were just listed on the previous slide. Now, fact questions need less time. So if you don't know it, don't worry about it. Answer it the best you can and move on. So, don't spend too much time on these questions because, you've got 180 minutes and you need to complete 180 questions. So some questions might take less than a minute. Some questions may take more than a minute. So the questions that test reasoning or they have a large amount of text within the initial bit of the question, you're going to need a bit more time. So factor this in. So remember, time flies when you're under pressure. When you're in the middle of the exam, practice time. It may be difficult to pace yourself. So practice time tests at home. So next slide, please.
Actually, if we just go to the previous slide.
is going to take over. So we'll go through.
Hello. Yeah, perfect. So at this point, I thought we'd go through some questions and just demonstrate some of the techniques that we've just discussed. I'm very quickly becoming the question master in these webinar sessions. So let's continue with that tradition. So basically, what we'll do is we'll go through some questions, and you'll understand the format in a few seconds' time. So instead of giving you the full minute, I thought we'd make it interesting and give you just the 45 seconds, because you're all very able and intelligent people, and I'm absolutely sure that 45 seconds will be plenty of time. So if we go on to the next slide, please. So this is question 1. Okay, so please have a read, have a think, write down your answers, post them in the comments, whatever you like. Okay, and next slide, please. Right, so this slide, so I thought we'd do a keyword slide. So every question, you will have certain words that are key that will help you identify the answer. And this one, the keywords are so 46, female, dark urine, pale stools, right upper quadrant pain, jaundice, Murphy sign positive. So this is one of those questions where you have to demonstrate understanding, and you have to work out the answer, the diagnosis first of all, to understand what the most appropriate investigation is. And this is going to be a gallstone related question. So now you're thinking, right, which of the following investigations is most useful? And I believe someone in the comments, well, several people in the comments very correctly pointed out the answer is C. So next slide, please. And yep, the answer is ultrasound of the abdomen. And the reason for that is because ultrasound will confirm the presence of gallstones. Urinary bilirubin, urobilinogen will simply confirm that there is an obstructive picture there, but it won't help you understand why that picture is there. And the other answers are incorrect. So yep, next slide, and on to next question. Okay, perfect. Next question, next slide. Not next question just yet, I'm getting ahead of myself. So I thought in this one, there's only really one key element to this question, and they're asking for the most important piece of advice. So clearly what they're saying is that there may be more than one correct answer, as Wahid mentioned earlier, but they want the most important piece of advice. So the main crux is that this is a hypothyroid patient, has been started on treatment with carbimazole. What do they need to know? What is the most important side effect of carbimazole? And next slide for the answer, please. And the answer is seek urgent medical attention if you develop signs of an infection or sore throat. So the reason for this, carbimazole obviously is a drug which is used in the management of thyrotoxicosis and is typically given for about 6 weeks. The main adverse effects for this are agranulocytosis, therefore immunosuppression. So you're telling the patient to seek medical attention if they have any signs of an infection. Also crosses the placenta. So the other question that may come up with this is, how would you treat a hypothyroid pregnant patient? And the answer is still with carbimazole, but on a lower dose due to it crossing the placenta. Next slide, please. We have many questions today. Answers are flying in. Next slide. Okay, so again, the key words here are just a few things. So patient is having packed red cells, and they have a history of heart failure. So what they're asking you to look towards is fluid overload, essentially. So the answer is absolutely correct. A, furosemide. Next slide, please. Stat dose of furosemide. Yeah, and that's simply, like I said, because this can transfusion can result in fluid overload. So furosemide would be prescribed in between with every other unit if more than 2 units are given. If they have a non-hemolytic febrile reaction to the transfusion, you can give IV paracetamol as well. But yeah, that's the answer there. So next question. Nice and easy one. The other thing is it shows you how long 1 minute is. This is just 45 seconds and feels like an absolute age. So this is the difference between having pressure and not having pressure. Good, next slide. With this one, there's no keywords. It's a standard knowledge question, which is what we were talking about earlier. You either know this or you don't. There's no working out, there's no problem solving in this. You need to know that apical fibrosis can be seen on chest X-ray in ankylosing spondylitis. That's all there is to it. So that question you'd expect to either know it or you don't. If you know it, great, you answer it, move on. If you don't know it, pick an answer, follow your instinct, flag it, and then decide, right, if I have time, I'll come back. What you shouldn't do is leave it blank thinking I'll come back to it, because guess what? You probably won't have time. 180 questions is a lot. So at least this way you'll have answered the question. Next slide, please. Question 5. Okay, so the reason I put this question straight after the last one was to demonstrate how one question, not all questions are created equal. One question will take you 10 seconds to read, the other question will take you nearly a whole minute just to read through everything in the question. So, so the whole point is it's not 1 minute per question. Next slide, please. So keywords, adenocarcinoma, descending colon. Actually, I think 3 loops of bowel, small bowel resection is probably also key here. But because I know the answer, that's why I had confirmation bias there. And then the other keywords here are serous fluid, so still discharging, and they want an investigation which will offer the most definitive results. So again, there may be multiple correct investigations, but which is the one that will give you the diagnosis most definitively? Next slide, please. And the answer is cystogram, C, which essentially a cystogram just involves passing radio-opaque dye into the bladder, and then you perform X-rays to assess the bladder contents and see if the fluid from the bladder escapes into the abdominal cavity. If it does, that confirms that there is that the suture line isn't healing properly. Okay, next question. So lots of answers coming in again. Okay, so next slide. Right, so it's interesting, so many people are saying B. So it's a 9-month-old boy. And yes, the testes are not located in the scrotum, but the testes do appear when he's in the bath. Now, with a true undescended testes, that wouldn't happen. So the answer actually is, next slide, please, retractile testes, because that just suggests that the cremasteric reflex is very strong, and in a hot bath, the testes will descend, which suggests it's not true undescended testes. Next slide. You guys don't need the full, even 45 seconds from the looks of it. Okay, and next slide, please. So again, this one, there's no point in doing keywords. It's a basic knowledge question. And as everyone has already mentioned, the answer is serum AFP. Yeah, hepatocellular carcinoma is commonly diagnosed with imaging and an elevated alpha fetoprotein. Sometimes biopsy is never really used because there's a risk of seeding the cancer. And yeah, so next slide, please. Okay, so immediately with previous questions, you saw generally people are answering the same thing. With this question, there's more debate, there's more different answers. And the reason for this is that medical ethics is very specific between different countries, right? So whatever rules and laws apply in one country don't necessarily apply in another, which is again why doing these question banks is so important, because you understand what the UK land of the law is. So we'll go through the answers as well. So next slide, please. So keyword knife wound, so it's a crime. Refuses, so he does not consent. So what do you do? So basically what they're saying is there is a conflict here, in that you feel the police need to know, but the patient does not give you permission to talk to the police. So the correct answer in this one, if we move on to the next slide, is actually B, which is that because it's a crime, the police need to be told, because in this situation, by not disclosing this information or by not breaking confidentiality, you could put other people in society at risk. Whoever committed the crime could come to the hospital, so you could potentially be putting hospital staff or the patient at further risk again by not informing and identifying and telling the police. However, at this stage, you would tell the patient that, yes, I'm going to tell the police, but your specific details will not be given. So your confidentiality from your identity point of view will be maintained, but it is important that the police do find out so that they can investigate this further. So that would be the right answer. There was one option, which was withhold treatment until the patient gives you consent. That is never the answer. That was there in every question, and it's never the answer, just so you know. Okay, next question, please. Okay, next slide, please. So again, this is a keyword slide. So patient has hepatitis C, so communicable disease, important diagnosis, again, lack of consent, and best. So what I'm hoping you're starting to do is you're starting to analyze your question. When you read through those 50 to 100 words, you're saying, right, pick out the keywords. These are the 5 keywords that will help me identify what the examiner is asking me here, what the question is asking. And again, this is another confidentiality-based question. And the answer, if we move on to the next slide, is to tell him, as the majority of you said, tell him you're unable to discuss the diagnosis with him. Now, one of the answers was ask the family member to speak to the registrar, which may be an okay thing to do, but it's certainly not the best answer in this situation. So again, this is where you have to understand that there is more than one correct answer. So the GMC guidelines, if you want to have a look, just Google GMC confidentiality. And yeah, so confidentiality is important, but it's not absolute, as we discussed in the last question. There are situations where you will have to break confidentiality, but this isn't one of them. As you all correctly, most of you correctly said, you would tell the family member that you're unable to discuss the diagnosis with them because patient confidentiality is maintained even after a patient's death. So just because a patient has died doesn't mean that their wishes can now be ignored. So next question, please. And good. So as the majority of you said, that is A is the correct answer. If we move on to the next slide. So again, keywords here: pregnant, 28 weeks pregnant, high blood pressure, proteinuria, diagnosis, preeclampsia. Treatment, first line treatment for preeclampsia, labetalol. So as the majority of you said, labetalol is the correct answer. Yeah, so not much to say there. Fairly straightforward, first line treatment. By the way, Jonathan, I have another 10 questions. I don't know how much time we have. Are we okay to keep going? Do people want to do more questions? Happy to carry on?
I think so, yeah. I think we still have enough time. We still have at least another 15 minutes to continue with your session.
Excellent. So let's go on. Oh, good. Lots of yes on the chat as well. Perfect. Let's carry on then. Next question, please. Good. Next slide. So similar thing that we're doing in every question, picking out the important words here. So suprapubic, lower abdominal pain, vaginal bleeding, right shoulder tip pain it's more often seen in exam questions than it is in real life as far as clinical signs go. No contraception, and she's hypotensive. She's tachycardic. She has right iliac fossa tenderness. So what you're wondering here is this an ectopic pregnancy? So next slide. And obviously then you're thinking, is it ruptured? Because the patient is still just about hemodynamically stable, but headed in the wrong direction. So yeah, this is a classic history. Like I said, you'll see this more in exam questions than you'll see it in real life. But that's the whole point, in that when you do enough of these questions, you'll start to pick out these trends. You'll start to pick out the wording they always use for certain questions. And if you got this one wrong, guaranteed the next time you come across this question, you'll remember right shoulder tip pain, slightly low blood pressure, no contraception. You know what you're thinking. Pattern recognition basically is what we're doing here. Good. Next question. Okay, so lots of answers. Generally, people are thinking 5 years. Well, I think the answer is actually 3 years with the Nexplanon. So let's go on to the next slide. Yeah, 3 years. So I think people may have been thinking about the Mirena. So the Mirena coil is 5 years. The Nexplanon is your it's the implant. So the implant is actually effective for 3 years. Very effective. And yeah, it doesn't contain estrogen, so can be used in patients with a history of thromboembolism, migraines, etc. And it can be inserted straight away following a termination of pregnancy as well, if that can come up in a question as well. Good. Again, no, we didn't really need a keyword slide there. Fairly straightforward, self-evident question. So next slide, please. Yeah, so again, more variance on the answers with this question, isn't there? So again, this may be because different healthcare systems have different pathways for different symptoms. So this is where it becomes important to know UK-based referral criteria. And actually, the correct answer here is E, which is urgent 2-week wait referral. So the specialist has to be seen within 2 weeks. So the keywords are hoarse voice. I'd say 2 months is probably a keyword here as well. No previous infection. She's well in herself. So it's unexplained. So unexplained hoarse voice for a period of 2 months becomes an urgent referral. So next slide, please. Yeah, so essentially it's a red flag for ENT. If a patient has persistent unexplained hoarseness over the age of 45, then that's an urgent referral. A routine referral, again, you have to remember, routine referral duration will vary from country to country. In some countries, you could do a routine referral and see a specialist the following day. But in the NHS, a routine referral means typically 12 weeks before you see a specialist. So that may change the way you sort of look at the words routine and urgent. So yeah, something to bear in mind there. Next question, please. Okay, good. Next slide, please. So the key thing here, so the first paragraph is just setting the scene, giving you some basics about the patient's symptoms, nasal blockage, sneezing, rhinorrhea, fine. But the key word here is left-sided, so unilateral nasal polyp. And the reason that's important is that bilateral nasal polyps are fairly common and can be referred routinely to ENT. But unilateral, one-sided nasal polyps are actually an indication for an urgent referral for possible cancer. So if you just go on to the next slide again. Yeah, so like I said, unilateral nasal polyps, think cancer. So urgent referral. If it's bilateral, then you guys are absolutely right. First line would be steroid nasal spray. If that's not enough, you can add in an antihistamine as well and do an urgent referral to ENT. But unilateral, you've got to get them seen straight away. Next slide, please. Good, next slide. So keywords, head-on traffic collision. Now that is actually quite important because that gives you an idea about the type of injury and type of trauma and type of impact this knee may have had. So knee pain, fine. And the most important thing is, so when you do the draw test, there's posterior laxity of the joint, which suggests that this is a rupture of the posterior cruciate ligament. So next slide, please. Yeah, so it's the posterior cruciate. Again, that's orthopedic knowledge question. If you have been doing orthopedic examinations regularly, then you'll know when you do the draw test anteriorly, anterior cruciate. When you push back, then that's a posterior. Good. Next slide. And good. Next slide. So yeah, blood loss, packed red cells, feverish, so it's a transfusion reaction. And again, the key word here is first. They may need IV paracetamol as well, but what's the first thing you do? And as the vast majority of you correctly said, the first thing is stop the infusion. If it's an infusion reaction, stop the infusion, and then consider other options. So next slide. And there you go. Yeah, that is the first thing you would look at doing. Good. Let's have the next question. Okay. Yeah, a bit of variance again in the answers. Let's go on to the next slide. I can't remember if I did a keyword slide for this one. I did. Okay, so diagnosis is melanoma, which they've given you anyway, and it's the most important. So all of these may be prognostic factors, but which of these relates the most to a possible earlier mortality is what we're asking. So the single most important prognostic marker is the depth of the melanoma, which is part of the Breslow criteria. So if we go on to the next slide. Yeah, so the depth of the melanoma, it will give you most idea as to how invasive it is and whether it may have already spread. So this is much more important than the other answers. And so moving on. Question that everyone loves. Yeah, good. So pretty much everyone got that right, actually. And this again shows you differences between different countries. In countries where you have higher rates of infectious diseases, you guys probably read these blood tests a lot more frequently than, say, in the UK, where it's a relatively uncommon diagnosis. But essentially, you're right. The answer is immune following immunization. I believe HBsAg is an indicator for acute infection unless it's been positive for more than 6 months, in which case that implies chronic infection. HBs implies immunity. Anti-HBc suggests previous or current infection, I think. And HBeAg isn't on here. So yeah, that's fine. Let's have a look. Am I right as well? Next slide, please. Yeah, immune following immunization. Good. And next question. So this one's an interesting one. In that, okay, so we'll go on, okay, let's have a look at the next slide, first of all. Yeah, so it's a 1-week-old baby. so essentially newborn, with purulent discharge of both eyes. The reason that's important is, yes, minor conjunctivitis is common, but in a baby that young, who's just a week old, you need to take swabs urgently for microbiological investigation to rule out chlamydia and gonorrhea and gonococcus, essentially, infection. So next slide, please. And yeah, so you need to take swabs and send them urgently, and then you treat them with antibiotics while you're waiting for the swab results. Okay, last question coming up now. Good. So next slide, please. So again, keywords here, adult polycystic kidney disease. I'd say the main word there is screening. So not diagnosis, patient doesn't have any symptoms, so they are looking at screening, which would be different. And the correct screening is ultrasound. If we go into the next slide. So yeah, ultrasound abdomen is the most appropriate screening investigation. Yes, PKD1 and PKD2 are loci of adult polycystic kidney disease, which is an autosomal dominant condition. However, those are not screening tests. The ultrasound diagnostic criteria or for diagnosis as well is 2 cysts, unilateral or bilateral if under the age of 30. 2 cysts in both kidneys if aged 30 to 59, or 4 cysts in both kidneys if aged over 60. So that's why the ultrasound is the correct answer. And I think that is the end of the question section. If we go on to the next slide, yeah. So back to you, Wahid.
Thanks, Arun. Yeah, so hopefully those questions have given you a little bit of an insight into what the type of level that you need to be at within, to succeed on PLAB 1, and get all of the questions right, and the level of knowledge that you need to be at. And hopefully we've taken you through a little bit about the techniques to try and get the best mark. You discount the answer that you think is not going to be, and you work your way through the answers that are potentially right. So in summary, so I'm going to give a summary of PLAB. So it's a 2-stage examination. It's part 1 and part 2. So part 1 is the best answer format MCQs, which is the online exam. Part 2, remember, is the OSCE format. That's the one that you need to sit within the UK. So that's face-to-face examination or clinical scenarios that you have to sit within Manchester, UK. So part 1, you learn from multiple sources, so textbooks, question bank, social media. Part 2, we will say, form small groups, practice regularly, honest feedback with each other. And we have done another webinar which focuses on part 2 as well. So you can always log on to GGH or follow us on WH Medical on social media for details on PLAB 1 and PLAB 2. We have lots and lots of videos and Instagram posts and free material out there. And then once you're ready, you can go onto our website, whmedical.co.uk, to book our PLAB package. We do a range of different PLAB packages. So we do the all-inclusive package, which is help with PLAB 1, preparation, PLAB 2, accommodation. All of the details will be on our website to book for the new year. And hopefully once we're at the other side of the COVID situation and once the pandemic settles down, we look forward to meeting a lot of you in person when you attend for our, hopefully, a face-to-face course within Crewe on our campus near Manchester. So you can contact us. Jonathan has very kindly put on the links to our Instagram page and our website, or contact us via GGH as well. If you want to book the course via them, you can also contact them as well. So thank you very much.
Right, okay.
Much.
This has been a very enthusiastic crowd, I think, today. It's very exciting to see this much enthusiasm in such a very short period of time. So I think now is we're going to open a short Q&A session. So if anyone has any questions, if they were wondering about anything and inquiries, you can shoot them down in the global chat column and we'll be happy to answer them. We have still about 20 minutes. Ursulinka, Dr. Ursulinka, did you wish to add anything?
Yeah, wow, those questions, Dr. Harun, oh my God.
Easy, right? You got them all right.
No, I think I got 4 to 5 questions wrong, especially about medical ethics. Oh my God, I should learn more about the UK medical ethics system.
But that's why we say do the question bank and then do it again, because repetition is key. You've done it once, so now if you ever see a question about a gun crime or knife crime next time, you'll know, actually, I do need to inform the police.
True. Yeah, I had no idea about that. Like, oh wow, what should I do in that situation? So yeah, wow, I need to learn more about that. Definitely. So yeah, please guys, ask away if you have any questions. We'll be happy to answer them with our specialists, Dr. Wahid and Dr. Harun. And yeah, for those who are not book your PLAB package with WH, please do so, and so you can practice a lot every day. And hopefully you pass your first attempt. So you don't need to repeat the whole, how many questions again? 180 questions, yes, right. So yeah, just do once and then be done with it.
Absolutely.
Oh yeah,
right.
Okay.
We actually have a couple of questions, and I'd like to apologize beforehand if I'm butchering any names. So Akshita wants to know how to prepare for the ethical portion for PLAB. Is there any strategy to master the ethical parts of the exam?
Essentially, it's the question bank again, because on the question bank, you can separate out by topic. So you select the ethical questions, highlight those, and I think there's about 90 to 95 questions on the ethical dilemmas on the question bank. So once you've done about 90 questions on medical ethics, you'll know more than most people do. And the key there is when you answer a question and you go through the answer, read the answer properly. There's links on the side that link to the GMC confidentiality page. So the other option is you just Google GMC confidentiality, and there's a really nice document which outlines everything to do with confidentiality specifically. So answer a question, figure out what the concept is, and just Google it. And on the GMC website, or MDU, or MDU is the Medical Defense Union, they also have a lot of stuff on medical ethics and scenarios. They do a lot of scenario-based stuff as well, and it's all free.
Oh, that's awesome.
I think that answers the other question. There's another question from Shrisha. She's asking for the best resources for PLAB 1 preparation. Would you?
So I'm going to link that with another question about a textbook, which is that which we've already gone through, that textbook is the wrong way to prepare for this exam, because it's not an exam of knowledge and eponymous syndromes and Rapunzel syndrome presenting features. It's not that kind of exam. It's more about presentation. So they always present you with a clinical situation, and you have to work out the diagnosis and you have to work out what's going on. And that's what I was trying to do in those questions, give you types of questions where you had to answer the question, you have to first make the diagnosis and then answer the question. So it's actually two-step question, essentially. And the best resource is just practice. There are multiple question banks, right? So if you wanted, you could sign up to 5 different question banks and have access to about 10,000 questions if you really wanted, which is absolutely fine. But I wouldn't do that because you'll go insane, because that's too much information. So pick one question bank. There's about, I think, 2,000 or 3,000 questions on there. That will give you a broad understanding. That will give you your technique on how to approach the question, understand the question, pattern recognize. And then, like I say, once you've done the questions and you do them second time, you'll see your pass mark first time around. Dr. Salinka said she today got 5 wrong. Next 20 questions she does, then you may get another 5 wrong. But after about 200, 300 questions, you start getting 1 or 2 wrong, because you're not learning new information, you're learning how to answer a question in its current format.
Yes, exactly, Dr. Harun. Oh, hopefully. Maybe. Wow. Next question.
Perfect. That's another 2 questions from Wasim Arfath. He's asking how many hours of study is required per day. I think it's interesting to see your take on this question. And how many months of prep is sufficient to clear the exam? So please.
That just depends on your life-work balance, doesn't it? So if you're doing a job where you are not getting home till 9 or 10 at night, then you're only going to have an hour a day to prepare. If you then have young children, for example, that's going to limit your preparation time as well. So it's going to vary from person to person. I would say do some questions for a week, see how many questions you get through in a week, in an average week for you. See how many questions there are in total, times that by 2, divided by the number of questions you can do per day. I've turned this into a maths exam. That will roughly give you how many days preparation you need in your particular life.
Yeah, I would say normally around about 2 to 3 months is usually okay. But again, like Harun said, it's often how busy you are that will determine how many hours a day or how long it's going to take you to prepare. Like I said, we do, if you look at our website, we do lots of different packages as well, so for different access. So one of the things, if you go through our full package, so that's the one that we'd recommend, you get 6 months access to our question bank, to a question bank. And remember, this is lots of additional things that you also get in terms of the PLAB 2 course as well. So and you'd have time to pay that in installments. So you've got plenty of time to prepare if you use the question bank that we recommend. And you have access to WH medical tutors for any bits that perhaps you might be stuck on, or you think I need additional resources, or you just can't get your head around, say, medical ethics, or you just can't get your head around bits of neurology. We're always there to help.
Yep. So book your PLAB package now, guys, and start practicing.
Perfect. Yeah, I think that covers the question. Right, thank you for the answers. There's another one referring back to the question on ethics. Would you recommend reading all the links provided by GMC on ethics, or just the questions are enough?
It's a good. Sorry, go on.
No, I would say there are fundamental principles within ethics. Okay, so you need to have an understanding around capacity, you need to have an understanding around confidentiality, and I think you need to get your head around those. So once you understand the principles around ethics, which is what you can find from the links that Harun mentioned, on via the GMC website, I think once you understand those principles, then it's about application. So there's no point applying things that you don't necessarily have the full understanding of. So what we say is go on the GMC website, see if you can understand capacity and consent and things around communicable diseases, or things around when you can break confidentiality. All of those things, if you understand those and the principles behind them, then you'd find that actually answering those questions is a bit easier. And then you can go on to the question banks and say, well, actually, yes, I know how to answer this because of these principles. And the questions aren't, the questions are designed in such a way to where those principles are underpinned. So, you know, you won't find a question which gives you an answer where it's completely against GMC guidance. You know, GMC, you know, the ethical guidance should be your blueprint, as it were. Once you understand that, then you can go on to the question banks.
Yeah, that's a really good point, actually, in that you have 4 or 5 basic ethical principles. You're absolutely right. And if you understand those principles and you apply them to the question, even if you haven't read the specific guidance, you know, you can work out in the vast majority of cases what the right answer is. At the very least, you can rule out 2 or 3 wrong answers and make your life a lot easier. So that's a good point.
I'll definitely do that.
Yeah, absolutely. It's a good way of doing it.
Oh, wow. Is there any questions, guys? Yeah, just to remind you guys, please do check out our website, both Great Global Hanlyn and WH Medical. We provide every information that you may need. Yeah, and maybe check out our Instagram as well. John is actively doing the PLAB questions there. Just make sure you have all the information that you need to prepare your PLAB 1 bookings through WH or any sort of like process through getting the employment in the UK with GGH. So yeah, just check out our website and social media, guys. And also, please do book your PLAB 1 package because you need to practice from now. Like they said, 1,000 or 2,000 questions.
Yep.
Yeah. Okay. Wow. That's good. Back to you, Jonathan.
Right. So I think just a final summary before I close the session. I think when it comes to exams, repetition and practice is key for success. I think that's the take-home message we can all bring back from this session. And so this final salvo from Salinka marks the end of today's insightful webinar session. Once again, we'd like to thank Dr. Wahid and Dr. Haroon for imparting this useful information, which I'm sure would be useful for everyone in here. And a final plug before ending the session, don't forget to follow our social links for the latest updates and information so you don't miss out on any application deadlines and future webinars. And we hope to see you all as full-time practitioners, hopefully in the UK someday, and come apply for trainings with WH Medical via the website or via our website. And with that, I give the floor back to the organizing committee. It's been a huge pleasure of mine moderating this event, and from where I'm right now. Good evening, everybody. Thank you.
Thank you, everyone. Wow.